And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele. We are talking about a bunch of different topics, and we're going to be posting the doctor's phone number later, so get ready for that as well. Thank you, doctor. Welcome back. Our next topic, gynecomastia. What is that?
That is male breast enlargement. So men don't really like their breasts enlarged.
No.
So I do a lot of reductions.
Oh, okay.
And it can be just the area behind the nipple, or the areola, if it's just glandular tissue, or sometimes there's a little bit of fat distributed more evenly through the breast, and we'll do something more along the lines of liposuction in order to remove that.
When does a man come in and finally say, okay, I need this done? I mean, what causes that person to come in and say, I need help?
Well, it's interesting because the hormones definitely affect it, and it doesn't seem like the hormones have to be at a high level. It just seems like the glandular tissue is more sensitive to hormones in some men than others. If you look at any newborn male, they have little breast buds because of the hormones from the mother. And usually over the course of a few months, it goes away.
Right.
Puberty is the next most common time when we see it. So as men go through adolescence, their hormones change. 65% of men will grow some sort of breast tissue during that time. Fortunately, many of them will go away within a year or two. So I see a lot of folks at adolescence, and if they're just starting through adolescence, I usually recommend them waiting a couple years to see what's going to happen.
See if it goes away.
Because if it's going to go away, great, just let it go away.
And weight gain?
Weight gain can augment it, but sometimes it disguises it. I'll have patients who have always had gynecomastia, really didn't know because they were overweight, and then they lose weight, and then we can see the glandular tissue because it may not be lost. The fat will go away, but the gland may not.
Oh, that's interesting. So then what is the difference between male and female gynecomastia?
Well, females are supposed to have breasts.
Oh, okay,
so in a female, that's normal. For a man, that's not so good.
What's the difference between like how you do that?
Did I misunderstand your question? So the reduction on women, I usually have to worry about skin.
That's what I mean.
As well as the breast. So for men, a lot of times it's a small, like a walnut size. I can remove that and the skin will shrink and do fine, especially if it's a younger man. If it's somebody who weighed 200 pounds extra and they've lost weight, same problems we have with the female breast in that the skin is excessive, the nipple's below the fold, the skin's hanging below the fold, they can't pass the pencil test. Then we want to do something to remove skin. So in those cases, it's more than just a little incision around the areola or a little incision in the armpit to do lipo. It's an incision goes all the way underneath the breast, just like the incision we make for breast lifts, and we remove that skin.
Well, I was wondering about that because you can hide the scar with the female, but you can't really hide it with the male, so how do you do that?
It's more visible. But it tends to heal pretty well in that area. And I think because of the weight of the breast is pushing there, it tends to push the scar together. We don't get as many wide scars or radical scars in that area.
How common is this problem?
Very common, 35% of men. And if it's a small amount, we live with it. We may not even know that it's a problem. If it gets larger, then it's more likely to come to my attention.
Take a look at some pictures. Number one.
So here's the gentleman we were talking about where the scar is.
Yes.
He has a scar under his breast.
Oh, yeah. You can.
And it runs from the inner part of the breast all the way to the outside. You can see a little shadowing on the outside.
Yeah, but not much at all. And hair tends to help with that, too.
Hair tends to hide it. Men do. Some men still keep hair on their chest these days. It's becoming less common.
Just a little.
And in this case, the nipple was not too low, so I didn't do anything other than remove the skin beneath the nipple and tighten it up. When the nipple is very, very low, sometimes we have to remove it like a skin graft.
Oh, you do?
And move it up onto the chest.
Oh.
Now, that gets rid of sensation, but men usually aren't too worried about that.
Men don't care about that too much.
Women would not be happy with that.
Number two.
So here's someone with a lot of glandular tissue and a little bit of fat. So what I've done is I've made a small incision up in the armpit, done liposuction to remove the fat. And it kind of defines where the gland is. And then I make another incision right underneath it, sort of from 4 to 8 o'clock around the nipple, around the areola, and remove that glandular tissue directly. The tricky part is you can't remove everything or we'll get an indentation.
Oh, okay.
So you need to leave a little bit of glandular tissue there. So it's ideal if someone's at their appropriate weight before we do this procedure.
Oh, so
if they lose a lot of weight, maybe the gland will look a little bit big again. If they gain weight, maybe it'll look a little indented.
All right, and we have another picture.
And then similar, so here's a bodybuilder, excellent shape. He couldn't lose any more fat if he wanted to.
No.
But he's got that loose skin, that little bit of glandular tissue at the inferior base.
You can barely see that too.
But when you're competing,
it does show big time.
So what we've done is brought that up, and I mean, no matter how great he looks beforehand, he feels even better afterwards. And that's the best part of the job.
If he doesn't have a lot of fat, where's his scar going?
So his is right around the areola.
Oh, okay.
So in his case, don't need to do any lipo. Just need to sneak out that little bit of glandular tissue, and the skin shrinks itself.
It's fantastic. It's a really good job. Now, what is recovery time for all these?
Usually it's like you did a bunch of push-ups, so it's a muscle ache kind of soreness.
Oh,
so
really?
Usually the first couple days, pretty sore, and by 3-4 days, people are feeling pretty good. I think in a week, they'll still know it's sore, they did something.
Yeah.
But it tends to heal pretty quickly. With the bigger situations where we're removing skin and having to undermine more skin, so making a pocket underneath the skin to tighten it, sometimes fluid will develop underneath there, and that may take a few weeks to go away.
And I know a lot of men aren't, they won't come in, even if they know they have a problem. They're afraid to come in.
By the time they come in, they've decided they need to do something about it.
It's ready to go.
Yeah.
But they should maybe come in a little before that.
Well, it helps to come in and just learn what the information is.
Exactly.
And,
get informed.
Get the information, then decide if it's a good idea or not.
All right. For more information about Dr. Mele, you can call 925-943-6353. Check him out on the web, drmele.com or sanfranciscobreast.com. We have more to come on Body Beautiful. Stay tuned.